Greetings, slackers. Today is December 13th, 2013. No, it's not 2013. It's 2015. Get out of here with that. Excuse me. Where was my mind at? Anyway, I found an article over here on the San Diego Union Tribune, and this is a health-related article that I thought that I'd share with you. STDs mostly increase in county, nation. Health experts are especially concerned about pregnant women passing on diseases to their kids. And this is by Paul Sisson. Gonorrhea and syphilis rates continue to rise in San Diego County, and public health officials are keeping an especially close eye on the small but growing number of pregnant women at risk of passing sexually transmitted diseases to their unborn children. New data from the U.S. Centers for Disease Control and Prevention show that an ongoing increase in STD rates nationwide continued in 2014. Experts point to a range of factors driving the increases, from limited funding for intervention programs to dating apps that make traditional anti-STD outreach methods less effective. Last year, the national rate of chlamydia infection was 456 cases per 100,000 residents, the highest recorded by the CDC since 1984. The first year that records are available for the disease. San Diego's chlamydia rate topped the nation's last year, but actually decreased compared to the figure from 2013. Local cases of syphilis showed a 24% year-over-year increase from 2013 to 2014. According to the CDC, gonorrhea rates in the county also jumped 21% during the same period. Women have historically contracted syphilis at much lower rates than men, and that was still the case last year. But the number of confirmed syphilis cases are increasing more quickly in women than they are in men, and more expected mothers are passing on their infections to their children before birth. Yee. That trend is particularly troubling to the public health community. The overall syphilis epidemic has grown and is now affecting more women. We also saw 100 congenital syphilis cases in 2014. That was nearly a doubling in 1 year, said Dr. Heidi Bauer, chief of the STD control branch at the California Department of Public Health. Experts said congenital syphilis is a strong warning signal about challenges with public health surveillance and treatment because the condition is 100% preventable if women are treated with penicillin before giving birth. Left untreated, syphilis can cause a host of severe health effects. It starts with unexplained sores and rashes and can progress to paralysis, blindness, internal organ damage, and death. The disease is linked with higher rates of premature birth and stillbirth, and untreated children often develop problems in multiple organs. There were 6 stillbirths due to the disease last year in California, Bauer said, adding that patients involved tend to share certain characteristics. The cases we're seeing tend to be among women who are fairly poor and have poor access to health services. In general, they're very marginalized, often in homeless populations, she said. The state's highest rates of congenital syphilis last year were reported in regions such as Fresno, Inyo, Kern, and Imperial counties. While San Diego's rate was lower than the statewide average, local public health officials have still taken notice. Dr. M. Winston Tillman, hope I said his name right, the STD controller for San Diego County, said his office reviews every case of congenital syphilis and does outreach to urge that pregnant women in the high-risk groups get tested for the disease at least once during the pregnancy and to be tested as soon as possible. We're definitely giving women of childbearing age top priority. We're concerned about this trend, and it's something we're definitely monitoring closely, Tillman said. He said there is work to be done, not just in initial screening efforts, but also in follow-up testing for at-risk women in their 3rd trimester of pregnancy if they have moved on to a new relationship or if they are known to have multiple sexual partners. He also noted that an initial test result showing no syphilis does not ensure that the disease will not be contracted later if the expected mother subsequently engages in unsafe sexual activity. We need to make sure that our healthcare providers out there in the communities know how to manage syphilis, Tillman said. Meanwhile, the county recently implemented the Don't Think No program, which sends a free testing kit to interested women's homes, allowing them more convenience because they do not have to visit one of the county's STD clinics or go to the doctor's office. The program is on hiatus due to technological issues, but is expected to resume in January. Congenital syphilis is viewed by the public health community as something of a canary in the coal mine, said Dr. Jeffrey Klausner, a professor of medicine and public health at the UCLA David Geffen School of Medicine. It's really a marker of a failed public health system because congenital syphilis is completely preventable. It means that the symptoms, still likely access to adequate prenatal care, are not working, said Klausner, who was analyzed and written about STD prevention efforts. As to why San Diego County and the nation have seen a multi-year trend of generally rising STD rates, Klausner pointed to funding cuts for prevention programs enacted in 2008 as a primary driver. The funding is always chasing the rates of STDs. Rates go down, funding goes away. Rates increase, funding goes up, Klausner said. California's health officials said state funding for anti-STD programs has stayed flat since 2007. Klausner said if agencies and nonprofit groups manage to secure more money for their STD projects, it will not be enough to beef up programs that have existed for decades, especially those that ask young people to visit their doctors and be tested. Today's teenagers and young adults are living much more connected lives than they were even 5 years ago, he said. Increasingly, sexual partners are being discovered through dating apps on smartphones. This immediacy, Klausner said, creates impatience with STD testing, which can take a week to provide results. He recently returned from London, where he said he saw the future of public health, a clinic equipped with touchscreen computers and rapid testing equipment. You just enter your information into a touchscreen computer, duck into the restroom to provide a urine sample, hand it over, and you've got your results in text message within 6 hours, Klausner said. He noted that research is also being conducted on ways to securely store test results on smartphones where they can be shared with potential partners more conveniently. These types of strategies are sorely needed in America's most technologically savvy state, he said. We could do a lot better in California by bringing some of these tools forward, Klausner said. Well, we made it through it. But, what are your thoughts and comments on this? Because there have been articles that have come out in recent years basically pointing a finger at hookup culture and dating apps speeding up the process of you being able to meet people, which I would probably have to agree with. And people are meeting each other faster, so it's only natural that situations are occurring faster. And so with people having multiple sexual partners and unprotected sex, this is going to lead to the proliferation and basically an explosive situation, especially if you listen to a news report that I covered probably a couple weeks back now, where they were talking about antibiotics in the meat. And right now, people are being over medicated with antibiotics because you're getting it through the meat. And then also when you go to the hospital, the first thing doctors want to do is give you an antibiotic for whatever sickness or illness that you have. So there's some abuse going on there. People's immune systems are going down. And also, if you take a look at this picture, I'll just point something out to you. You see that cigarette in the man's hand right here. Well, this hasn't really been discussed. And, I think that it's a really poor discussion of the media to, educate people. Of course, it's up to you to always educate yourself, but there is a link between cigarette smoking and HPV. And this is not being discussed, but you can look online. I will link to an article down below in the description box so you can see more. But anyways, again, leave your thoughts and comments. And that's going to do it for this article. I'll catch you in the next one. September Man, out.